I might illustrate how we begin to think differently. This is a case of Isabel. Isabel was 10 years old. She came to my office, cutest little thing, loved horses, came from Texas, and was miserable. She had mixed connective tissue disease, and everything was inflamed. So she had arthritis, joints were hurting, myositis, her muscles were hurting and inflamed. She had Raynaud's, her blood vessels were inflamed, anemia was affecting her bone marrow. She was exhausted. And by taking her history, there are a couple of interesting facts. One, she loved tuna and been eating sushi since she was 2. She'd taken lots of antibiotics for ear infections and sore throats, and she was eating a lot of sugar and dairy. And we looked at her labs. You can see the labs here. It's just staggering amount of abnormalities. ANA 1 to 1280, the rheumatoid factor high, anti-double-stranded DNA, lupus anticoagulant, CPK of 475, aldolase high, fatty liver elevation, abnormal liver function tests, elevated SID rate, and so on, low vitamin D and anemia. These are not insignificant. And by the way, most rheumatologists will check it once and not check it again because they go, oh, they don't change. But I can tell you that if you fix people, they do change. So what do we do? Well, we didn't do what they were doing with her traditional care, which was intravenous solumedrol, 1,200 milligrams every 3 weeks. That's like a horse dose. And she was on methotrexate, prednisone, a PPI, nifedipine, calcium channel blocker, and aspirin. Because she was treating her Raynaud's, she was treating her reflux, she was treating steroids to help calm things down orally, methotrexate, aspirin for coagulopathy, all of it was just terrible. So I said, well, what could be causing this? And so when someone comes in with a diagnosis, I go, well, what's the cause? So she's got an inflammatory disease. That's clear. What's causing the inflammation? Why is the immune system so pissed off? It's not a question we learn how to ask in medicine. We like, oh, I know why your muscles and joints hurt. You have mixed connective tissue disease. No, that's just a name that we give to people who have sore joints and muscles and all these other things that you see in these patients. What she had was an inflammatory disease triggered by things that were going on that she could reverse. So she had high levels of anti-gliadin antibodies, not true celiac, but definitely triggering an immune response. She has a positive HLA-DQ2 gene, which is a celiac gene. She didn't have a lot of stool or gut symptoms, but she had a high calprotectin. Now, this is not a level you'll see with a colitis, but you'll see this level in patients who have a little bit of low-grade gut inflammation. And we know the microbiome plays a huge role, the gut plays a huge role in immune diseases. And on a provoked urine test, she had, with DMSA, she had a very high level of mercury. So what do? Well, we took out the bad stuff. And functional medicine ultimately comes down to us. And Dan Lucas gets very mad at me for saying this. I always say functional medicine is hard to understand, but easy to practice. So it comes down to once you understand what's out of balance and what you have too much of, you need to get rid of, and not enough of, you need to get. And you do that, you take out the bad stuff, put in the good stuff. The body knows what to do. The body actually is super intelligent. And so we cut out junk, we cut out sugar, dairy, gluten, and we then treated her gut. She's of all the antibiotics. I gave her some nystatin. I gave her some probiotics. I gave her some nutritional support. She was very low in vitamin D, and I gave her omega-3 fats and multivitamin, not an aggressive approach. We had to get the metals out, so we used DMSA, milk thistle, NAC, and other binders and so forth. And it's a very important strategy on how you do the metals. You can't just do them because you can hurt people. But it worked for her. And 2 months later, she was symptom-free, and her labs were getting better. And then it was really impressive. She was able to be with her horse. And the whole idea here is that, our whole concept of disease is wrong. And this is a JAMA paper, and I would say my favorite alternative medical journal is JAMA. It's all in there. The concept of disease is obsolete. I would say the concept of dementia, but I would say the concept of, you could put anything in there, heart disease, cancer, diabetes, arthritis. The concept of disease is obsolete. It combines categorical misclassification with etiologic imprecision. So what does that mean? Well, we're categorizing people according to symptoms, not causes. So we put people in buckets. For example, dementia is a syndrome. What's causing it? Is it hypertensive changes? Is it Alzheimer's, amyloid? Is it heavy metal toxicity? Who knows? What is it, right? Is it gluten? All of it can cause dementia. Now, this is Isabel telling her story, so you can hear it.
I have mixed connective tissue disease. And my first treatment was I was on high doses of solumedrol, methotrexate, and prednisone. My face swelled up like a grapefruit. Then I went to go see Dr. Hymen. He put me on a gluten-free, sugar-free, dairy-free diet and supplements. And now, a year and a half later, I can ride my horse. I can show I'm off of all of those stupid medications. And I feel great.
So you can see from Isabel's case that she recovered from a condition that we think is often not treatable in the sense that it's curable. We manage the disease with drugs, we suppress the inflammation, but we don't address the root causes and we don't cure the patient. And I saw her many years ago, and I recently called her up just curious how she's doing. And she was in college, doing great and symptom free.